I'm Representative April Berg, and welcome to my kitchen. I am so excited today to have not only a friend, but a colleague, Dr. Sharon Shewmake, with us to talk about the economy. It's something top of mind for so many people. Dr. Shewmake is coming to us from Bellingham, and I'm going to let her introduce herself because she's got some pretty cool stuff that she does during the day.
Thank you, April. So my background is I'm an economics professor at Western Washington University, where I mostly do environmental economics. I'm fascinated by how people make decisions about energy and housing, but that also spills into transportation and urban economics. The reason I became an economist is I felt like I was taking all these classes about things that I really cared about. So, protecting the environment, but also eliminating deep poverty and making for a more just, more equitable world. And economics was one of the fields that seemed to have explanations and solutions. People talk about it as the dismal science, but I actually love the simplicity of economics, but also the sorry, not the simplicity. I love the elegance of economics, but I also really love that when an economist wants to know, does X cause Y? Does a policy improve poverty outcomes? We don't just sit around and say that it does because I like that policy. We go out and we test it with data and evidence. And so I think that's a really important thing to bring into the policy conversation as well is if we're going to go ahead and do something, we want to make the world a just, better, fairer place. Let's make sure that we're using policies that align with our values and that the impacts are really what we think they're going to be.
That is amazing. And now everyone at home can see exactly why I love working with Dr. Shewmake, Reps Shewmake. And it was interesting that you used the word dismal, that's because it's not, it's fascinating. And to your point, it's about data. And as policymakers, data is really important. I tell you, it was an interesting first term for me. It had a lot of things that we did as a legislature that were amazing, helping families, helping working families in particular. And one of the things that I was most proud of to do with you is pass the funding for the working families tax credit. I found it to be just a crucial piece of legislation. And it was important that we pass it so that we could really help working families financially. So I guess can you talk to me and us about why it was important to reduce taxes for working families and frankly why it's an investment in our future?
Yeah, so just so everyone knows, the Working Families Tax Credit is a rebate to the federal policy called the Earned Income Tax Credit. And the Earned Income Tax Credit, if you've received it, then you know about it, but it's kind of a negative income tax. So normally you may make $1 and you pay 10 cents to the federal government to pay for all the things the federal government does. With the Earned Income Tax Credit, instead what happens is you get 15 cents in addition to that dollar, right? So it really rewards you for working, which is really important when you're at the lower end of the income spectrum, because sometimes you get ahead and you can actually be worse off if you lose your food benefits or if you lose your housing assistance. And so it can really feel to families that, we work, but we can't really get ahead. Whereas the earned income tax credit still allows you to reap those benefits of work. And so we see it as one of the most important labor policies, one of the most important innovations that we've seen in the past 30 or something years.
Yeah.
And especially in terms of getting women and especially single mothers to work again. And so when we look at the benefits of that, it's to the labor market, but we also see it to the families. We see it to the kids. We see that kids in families where they received an earned income tax credit are more likely to do better in school in both K through 12, especially their math scores go up. We see that they're more likely to finish high school. They're more likely to go to college. And we see that they're more likely to be participants in the labor force when they grow up and are as adults. And part of that we think is linked to better health outcomes. When kids grow up in poverty, sometimes they don't get all the things they need to properly develop. And I think that's a tragedy. I'm a mother. I worry about this for every kid here in Washington State and our country. But programs, anti-poverty programs like the child tax credit, the working families tax rebate, what those can do is they can mitigate some of those impacts of poverty and result in a more resilient, a healthier, a wealthier working workforce.
That is huge. And I love the way that you described it's about work and it's about rewarding work and rewarding the families that are participating in our workforce. And sometimes that participation creates negative consequences, right? Like losing benefits and things that you laid out. And so those are barriers. They're real barriers, and they're barriers that, again, working with you this last session to really overcome and eliminate those barriers has been a huge part of our focus. So let's talk about some other barriers. One big one that came up a lot last session was early learning. And not only, childcare, early learning opportunities being not so prevalent, but also, the ones that are, like, why is it a good economic investment in our state? Why should we care about early learning and investing in it as a state?
Early learning is a fantastic investment. We see that for every $1 we spend, we see about $7 to $9 worth of benefits. And this is from really high quality randomized control trials, which are kind of the gold standard in social science. And so what they did is they looked at some really high poverty kids in Chicago, but this has been replicated in other places as well. They
Mhm.
basically flipped a coin, and some of those kids got access to a high quality early learning program. Some of them, because there weren't enough resources, they didn't. And then they followed these kids for 40 years as they grew up.
Yeah.
And they saw that kids that had access to early learning, their parents made more money. The kids made more money when they grew up. They
Mhm.
did better in school. They were more likely to attend college. But we also saw that we saw lower K through 12 special ed costs because you were able to get at those
Yeah.
early. We also saw that there were lower rates of incarceration, and incarceration is so expensive
Yes,
that there's a
it is.
way that you can reduce it that still maintains public safety. That's
Mhm.
often going to pay off in a cost benefit analysis. But then we also saw benefits that are harder for us to quantify, like lower levels of drug abuse, lower levels of domestic violence. And so it seems kind of like a lot, but I'll tell you, I saw it with my own kids. You send them to preschool and they learn to sit and they learn to listen, and then they arrive in kindergarten ready to learn. And if you look at the economics of K through 12 education, especially, there's just so much inequity baked in by the time they come to kindergarten ready to learn that it's hard for the K through 12 system to catch up. And so if we can get at them early and make sure that they're all prepared in kindergarten to sit in line and, get their lunch
Mhm.
and all the little things that those cute little 5-year-olds need to do, it benefits all of us.
Yeah. That's huge. And so I just need you to repeat that number again because it's so huge. You said it's a 1 to 9 return on investment. Is that, like, so for every $1 we're spending, we are getting back $9 in benefits, right? So from all of the things you just named, like lower incarceration rates, better health outcomes, better outcomes in terms of sending folks to their beyond high school opportunities. I mean, that's, in terms of an investment right now. I'm like sitting at home as a mother of six. Like when someone tells me there's a 1 to 9 investment ratio on something, I'm like raising my hand and jumping up. So thank you for that, because, and also thank you for pointing out all of the intersections for early learning, because sometimes folks think, oh, it's childcare, or oh, it's, I'm not in that season of life. So why does it matter? But everything you touched on touches somebody in their season of life. And so if we can have an impact through investing in early learning, I just got to say it, that's a good deal.
It's
So
a fantastic deal.
with,
And those
yeah,
studies are like sometimes you'll see numbers between 4 and 17, but I think
wow.
7 to $9 worth of benefits. That's about the median.
So that's that sweet spot.
Yeah.
Yeah. I'm just raising my hand. I want in. And so as a policymaker, that's important. Uh, and so let's keep talking about money, right? So wages. I mean, that's another area where folks are really having conversations about intersections, right? So you've got wages, you've got costs of living in our state, like housing, food access, transportation, education. All of those things are going up. We've seen gains in productivity, but as a person or somebody in the workforce, they're not necessarily seeing wages go up. So I'm wondering, just my question to you, we're a leader in our state in terms of minimum wage improvements. So why is that important? Why is setting a minimum wage important?
Yeah. So when I teach intro to economics, a lot of times what I'll talk about when we first start talking about it is the very basic model that shows when you require a price that's higher than the market price, then that means that that's going to increase unemployment, right? That there's going to be a surplus of labor, and unemployment is going to be higher than it otherwise would be. And so that was the thinking for a long time. But as we started to get better data and better techniques, as well as look at some really important kind of opportunities to tease out the impact of that minimum wage. So a big important study was in the 1990s, and they looked at what happened when New Jersey saw an increase in the minimum wage and communities in Pennsylvania did not. And so what happened to teen unemployment? So of the people that make minimum wage, I think over, I forget, I think it's 50%.
Yeah.
Of people that make
my teens make minimum wage, right? So that's, yeah.
I just had the number up. Let me make sure that I'm right. Sorry, when I teach this, I have a whiteboard, and so I get a little bit more intense, but
I need to be there, like, because I'm thinking you with the whiteboard, I'm going to learn a lot. That's huge.
So if we look at information from the Pew Research Service, we see that if we look at information from the Pew Research Center, we see that minimum wage workers are disproportionately young. Over 50% are ages 16 to 24. So if we saw an increase in unemployment as a result of an increase in minimum wage, we would especially expect to see that amongst teenagers. And when we look at that study between New Jersey and Pennsylvania, we don't really see an increase in unemployment. There doesn't seem to be an impact. And as we've gotten better data, so we've gotten better data and better techniques, we've seen that there doesn't seem to be an impact of a minimum wage in terms of increasing unemployment. There are still other impacts. Sometimes you might see lower hours cut or some other impact, but we generally see that it does end up benefiting most workers. And one of the reasons why is we have something called a monopsony power in the labor market. So I think most people know what a monopoly is, when there's just one seller of something and they charge a really high price. A monopsony is kind of the inverse of that. It's when there's only one buyer. And so they can require you to have a really low price. So think about, go ahead, sorry.
No, I was just saying it's interesting. You just taught me a new word. And so I'm literally like, it's longer than 6 letters. So Wordle is not going to, it's not going to do me any good, but that's it. Okay. Monopsony. So one buyer. Got it.
So with when you have a monopsony power, and say that you're the one employer in a small town, the market rate, if there were a whole lot of different employers and the same amount of work, it might be $24 an hour. But you know that if you're going to hire 100 people and pay $24 an hour, maybe you only want to hire 90, and then you can lower the rate at which you pay them. So they can kind of use that market power in a really similar way that a monopoly produces less product to charge a higher price. A monopsonist buys less product, in this case labor, and has a lower wage price. And so more modern economic models have tried to measure that monopsony influence on the labor market. And so that's one of the reasons we have some of these labor market protections, things like minimum wage, things like prohibitions on child labor, as well as pro-union efforts and pro-union laws as well.
So it's not only good for folks' bottom line, but it actually protects workers. It protects them from being at the, being able to be taken advantage of by one company or one, to your point, buyer. So, and just for the folks at home, whenever I can learn a new word, I am all over it. So that is just, thank you so much, Dr. Shewmake. That is huge. So, let's talk about, as we talk about labor standards, there are some intersections there that I have found fascinating. And some of those intersections hinge around diversity and inclusion. And why is it good for the economy, right? For your basic economics. And so talk to me a little bit about that intersection, and talk to me about why it's good for the economy.
So one of my favorite economists is Raj Chetty at Harvard, and he's been doing this incredible project at looking at the economics of opportunity and opportunity gaps in this nation. And one of the things that he looks at is who becomes an innovator, right? And we can measure innovations with patents. It's not just good ideas that you don't follow through on, but it's if someone gets a patent, that's a sign that they've invented something new. And so we look at who becomes an innovator. And overwhelmingly in this nation, it's white men from families that make $100,000 or more. I'm glad those people are doing innovations, but the question is, well, Why aren't women also
Yeah.
innovating at the same rate? Why aren't Black women innovating at the same rate? Why aren't white men from lower income families innovating at the same rate? And we do see that there's all those people, they're just as likely to be good at math in middle school, which would be one of those predictors.
Hmm.
But there isn't quite the infrastructure. There's not the mentoring. There's not the support. There's not the trust in those
Hmm.
networks. And so you can call it institutional racism. It's diversity and equity and inclusion gaps. It's all sorts of issues that combine to lower the innovation rate that we see in the United States. And if we can remove those barriers, Dr. Chetty, he does this back of the envelope calculation, and he finds that we would see an innovation rate that is 3 to 4 times higher than what it currently is. And that is incredible if you're talking about
Wow.
long-term economic growth. Because you think about the iPhones of today are built based on technology of the iPhones from a year ago. And so
Yeah.
that means that if we can innovate 4 times faster in just 1 year, that
Hmm.
means that we continue to build on that innovation rate year after year after year. And so we can talk about diversity, equity, and inclusion and removing barriers amongst, the really high productive, the innovators who are these geniuses, but we see it throughout the economy too. It also matters to make sure that you have the best nurse for that position when you
Yep.
need that person, right? So it matters to the innovators, but it also matters to all of us. And I'll also tell you just, I work at a business school at Western Washington University. And what we hear from the big businesses that employ our graduates is they want them to have
Hmm.
cross-cultural skills. They want them to be able to
Yes.
work in diverse environments. And that is as important or more important as being able to handle a spreadsheet and understand all the cases they went through. Business is about people.
Hmm.
Almost everything we do is about people on some level, and being able to communicate with people that have a different background, that look different, that pray different, that think different from you is an essential skill for a modern economy.
Wow. Okay. So that was a lot. And I love this so much because I just want to boil it down. So, increasing our innovation rate is good for everyone. And so, what you've just laid out is an intersection that seems very specific and particular, right? Diversity and inclusion, getting more diverse innovators, but that innovation rate being increased by 3 to 4 times overall, our entire economy, right, statewide, would be lifted up by increasing the innovation rate. I just want to make sure I have it right because that's a huge number
I mean, nationwide in a
nationwide. Oh, that's amazing. Yeah, thank you for that because that I think that puts in perspective why it's important that we all succeed, right? So that there's no when you look at a predictor like middle school math, it matters that everybody is successful as we quote unquote predict who's going to be successful in the future. The answer should be everyone. Everyone should have that opportunity. Um, and so as we're talking about kind of what I like to consider the all-in economy, right? So everybody's in. There's some things going on right now in our economy that folks are frankly they're talking about, and that's inflation, and the crisis of inflation. And we see that partly has to do with the impact of increased individual spending as we're coming out of this public health crisis. But can you talk to me and break down for our viewers just a little bit of what it means, inflation and this crisis of inflation? What does that mean to individuals and families in our state?
It's been really tough on families, and especially families on the edge. I've been out on the campaign trail and I've spoken to people whose, this might sound low and Snohomish, but people whose rent was 1,200 and is now 1,800 just in 1 month. And I don't have $600 a month to just throw
Wow.
into rent. I think a lot of us are in that situation, but it's not just rent. It's also, we're seeing it in gas prices. We're seeing it in food prices. We're seeing it across the board in travel prices.
Yeah.
Um, and so getting inflation under control is really, really important. Stable prices and low unemployment are the two mandates of the Federal Reserve. It's going to, I don't know. I'm not a macroeconomist.
But do you play one on TV?
Yeah, I can pretend to be one because I listen to Planet Money.
There you go. I love Planet Money.
Um, Inflation really impacts families, and it makes it really tough when you were already having a tough time and now you have to figure out how to have a little bit more money for your gas tank, for your food bill, for your rent. So
Yeah.
I think what we can do at the state level that would be most impactful on in reducing inflation is looking at our housing market and doing good work in housing policy.
Yeah, no, and that's huge. And when you talk about good work in housing policy and going there, I mean, as an economist, right? As a PhD economist, teaches this all day and all night. Middle housing, workforce housing, is that a part when you say, the housing crisis? What impact would focusing on middle housing, workforce housing have on that crisis?
Yeah, so we've all seen the impacts. I think we're all seeing increases in homelessness in our communities. And that's a bunch of impacts coming together. Some of that's
Yeah.
mental health, some of that's the fentanyl crisis, some of that's impacts of COVID-19 still coming through. But
Mhm.
it's also when we see an increase in rent that
Yeah.
deep stabilizes families. And there are so many folks that were doing fine for a while. They had a bad break, they lost their housing, and now they're on the streets.
Yep.
And if there's ways that we can prevent that from happening or figure out ways to mitigate this increase that we're seeing in housing prices, we can actually lower costs down the road from people then
Hmm.
being traumatized by spending time on the street. So, if you want to know how to solve the housing crisis, there's not just one answer, but there is one kind of concept, and that's it's a supply problem. We have underbuilt by about 180,000 to 250,000 homes
Hmm.
statewide, and we need to figure out how to build more homes. We can do that partially through the Housing Trust Fund,
Yep.
but we just put in a historic amount of money into the Housing Trust Fund, about $400 million, and the estimates is we're going to get about 4,000 units out of that.
Yep.
That's not going to fill that
No.
$180,000 gap.
No.
So we have to start looking at private market solutions. Some of that is making sure that it's easier to build within cities. We can either build up or we can build out. If we build up, we already have the infrastructure there. That's where the jobs are. That's where people want to live. That's where people grew up. And then it's a climate solution. It's an economic integration solution. It's an infrastructure solution. There
Yeah.
is still some places where we can build out, but we have to make sure and think about the consequences of building on farmlands, building in floodplains. My community just is still recovering from devastating flooding, and building in areas where you might be at risk of wildfires.
Hmm.
So some of the best land we've kind of already built on. And so can we use that more efficiently? And that's where policies like missing middle, allowing people
Yeah.
to, instead of just having single family homes being the only type of housing allowed, allowing for traditional modest forms of housing like duplexes, threeplexes, fourplexes, and making it a little bit easier to build. I also think there's some rules that we need to look at and try and get right on condos, how the homeowners associations work, etc. And these are really tough, tricky,
They are.
threading that needle to get the buildings that we know we need at
Yep.
price points that folks can afford.
Yep. And you really did hit the nail on the head. I can't resist a good pun, but it's just that we do need to build more, and it is a supply issue, And as we talk about things that you use the concept of, right, one bad break, and that put somebody during this pandemic into dire straits, and so another quote unquote bad break that we see pre-pandemic, during the pandemic, eventually when we hopefully get to post-pandemic, is healthcare, right? And so one literal bad break, and I'll tell you just from personal experience, having a health crisis of my own, being in a car accident, having 4 breaks in my back, at a time where I was not expecting that, put me into this sudden, unpredictable healthcare scenario. And so talk to us a little bit about why healthcare costs are so expensive, and maybe some solutions, some thoughts about bringing them down, especially because as a nation, we're in a pretty unique situation. It's, when you look across the country or across the world, we're kind of an outlier when it comes to healthcare.
Yeah, so we pay more per capita and get worse results than a lot of other industrialized nations. And it's tricky to figure out how to move from the healthcare system we have to what you might see in European countries that works better and costs less.
Yeah.
But there are some kind of smaller movements that we can take along that path. So one thing is more transparency in our healthcare system. My little one, he fell on a toy and got a big hole in his lip.
Oh,
And I know, I called urgent care and I asked, well, what does it cost to take him in? And nobody could tell me that price. And that matters because I did have options. I could have taken him to urgent care. I could have taken him to the ER. I
yep.
could have gone down to Skagit County. And so not knowing how much a hospital appointment is going to cost means that sometimes we are either too afraid to go or maybe we overutilize it, which kind of brings up to the point of how we pay for healthcare. It's a bewildering system. I have a PhD in economics and I still don't know which bills I'm supposed to pay. But it also means that sometimes we over prescribe things because we know that insurance is going to pay for it and the doctor wants to make sure that they gave you the best healthcare, even if it's not necessarily the most affordable healthcare. And I think the easiest way to kind of see this is I have two kids. One was born here at St. Joe's in Bellingham. The other one was born in England, where my husband grew up. And the one in England, I was 34 when he was born. It was a low risk pregnancy. I didn't see a doctor until I was delivering. I saw midwives the entire time, and that was the normal thing.
Wow.
And then once the baby was born, within 24 hours, a midwife came to my house. I had an emergency C-section. She checked on the C-section scar. She weighed the baby. She mostly just calmed us down.
Wow. Yeah.
But she was also looking to make sure that we were providing a warm, healthy, safe environment. Whereas in the United States, I met with a doctor once a week until I was giving birth towards the end. And then nobody bothered to check on me for 6 weeks. And they just let me take this little baby home with no instructions or anything. Right?
The manual. Yeah, exactly.
Whereas, in England, they looked at things like, well, where does the evidence show is it a cost-effective health innovation? And that is aftercare. Versus in America, it's what can we bill for? And so they were saying, let's do all the doctor's visits. Let's do extra ultrasounds. Let's do all of these things that were nice, but they weren't super important. Whereas in England, first of all, it was free. I didn't get a single bill, although they do pay higher taxes.
Wow.
But they also they look at the innovations that are cost effective. And I think that's just so important. It was so wonderful to have someone come to our house right after the baby was born, and then they followed up for weeks afterwards. And it was just such a supportive, wonderful system. And I have friends here who get postpartum depression and they don't know who to talk to, or they have trouble breastfeeding and they don't know who to reach out to. And that wasn't the issue in England. It was just so different.
That's huge. And it just sounds like, if I boil it down, right, you get what you need when you need it. And as a result, it's cost effective. And so it's huge. Having, I've never had the ability to give birth overseas, but I will tell you, all of my kids have different birth stories. And frankly, none of them were what I wanted, right? Because it was driven by something other than my needs or desires. It was driven by things that were cost effective. And frankly, my emergency C-section ended up with a child in NICU and us being terrified, and getting no at home aftercare. So, but thank you for illustrating that, because I think when it comes to healthcare costs, stories and real life stories are really what help people see that there is a better way. There's a better way to do this. Just kind of flipping the script a little bit and just moving on kind of to our last topic here, because I don't know about folks at home, but I've got a pen with me. I've been taking a lot of notes during this conversation because Rep Shewmake, Dr. Shewmake, my friend Sharon, is the best person to explain complicated issues in a way that I can take away meaningful action items. So thank you for having this conversation. So, I want to talk about a point of pride. We have the pleasure of representing folks in a state that I will tell you is home to some of the most amazing, innovative international companies like Boeing and Microsoft and Amazon and other big tech groups that were literally organically grown right here, right? We didn't go out as a state and recruit them. We didn't say, hey, come to our state, we're giving you a bunch of free land. They started here for a reason. And so, I'm just going to ask you, right, with your economist hat on, what did we do as a state to make this possible? And what role did investment in education play? And frankly, what can we do or what should we do to build on this success and remain competitive? Because I think as the future comes, we want to make sure we keep having good companies like that start and stay in our state.
So having an educated, innovative workforce is really important. Making sure that this is a place where people can experiment, try out new ideas, go after the next innovation. But also, if you want to start up an engineering firm,
Yeah.
you really want other engineers to live in your area, right? So we sometimes talk about that as a cluster in economics,
Mm-hmm.
especially when we're talking about tech. So you see a tech cluster in the Seattle area, you see a tech cluster in Silicon Valley, and there's a biotech cluster kind of in like the New Jersey area, right?
Yeah.
And the reason that's important is sometimes you have two engineers that are married to each other and they both want to be able to find jobs.
Yep.
Sometimes you have a very specialized type of engineering skill. And so you might want to work in a city that maybe you could work for Microsoft or you could work for Zillow or
Mm-hmm.
Expedia, right? And so all without having to completely uproot your life. And so you're able to the way I explain it to my students is Bellingham may not be able to support a world-class orthopedic surgeon,
Mm-hmm.
but Seattle can because you have enough people that you're able to spread that very specialized expertise amongst. And that's
Got
the
it.
same with very specialized expertise that you need for those kind of tech jobs going
Mm-hmm.
forward. So it's hard to build a cluster. We're lucky to have one. We're fortunate to have one.
Yeah.
It's easy to destroy them. We have seen governments destroy clusters with bad labor policies or not funding education or not doing a good job making sure that businesses have the infrastructure they need to really survive and thrive
Yeah.
and go after that next big idea.
That's huge. And I love the concept of clusters. I think sometimes folks call them hubs, innovation hubs. And it is that thought of building on each other, right? Like building on something good and making it better and making it grow. So I tell you, it's hard to even say these words, Sharon, but I got to land the plane and I really don't want to because I could talk all day. You are just a plethora of knowledge and expertise in the field of economics, but frankly, in kitchen table economics, right? And in our basic economy. So I got to ask you, this season, we're really focusing on policy and progress. And what are those policies prescriptions that lead to progress? So if you could, can you share with me, with the folks at home, what are those policy prescriptions that you feel like will lead to economic progress in our state?
So if we're zooming out and looking at the whole nation, I'd say
Mhm.
that one of the biggest threats to our economy, but also our democracy as well, is worsening income inequality.
Yes.
When you have people that are so powerful they can buy politicians, that is a threat to how our democracy functions, and it's a threat to how our economy functions. I think as state level politicians, one of the most important things we can work on is housing affordability.
Mm,
Housing. The increases in the price of rent and the cost of living is largely a housing problem. Of course, we see gas and food increasing as well, but it's that housing cost that's the biggest part of your budget.
yeah,
And it's also something that we have some say in, more so than we have say in worldwide commodity prices, right?
sure.
And so we got to get that supply right. And it's also something that one city can't build on its own. One city alone cannot build housing affordability, because when you have a city like Seattle that has a whole bunch of jobs and a whole bunch of people wanting to move there,
Yeah.
if people are moving there for the jobs, they're going to try and find the housing and they'll drive until they qualify, right?
Hmm.
So if
Hmm.
Seattle doesn't build enough housing, then that means that folks on the east side don't have enough affordable housing. And that means
Hmm.
it's even coming up to Snohomish and even up
Exactly.
here all the way up to Whatcom County. And
Mhm.
so I think we need some statewide solutions. Having lots of discussions, you and I, as well as
Yeah.
some other legislators, about what these could look like. We had a bill last session that was accessory dwelling units, saying that if you have a single family home in a single family neighborhood, as long as the lot isn't too big, then you can build an accessory dwelling unit and a detached and an attached ADU.
Yeah.
And so that's an easy way to get in some gentle density. When we look at who rents these things out, it's often well below market.
Hmm.
Portland has been really big on ADUs, and most of their ADUs are below market, oftentimes free to a family member, a caretaker, an artist,
Exactly.
etc. And so they're kind of these naturally affordable units that I think enhance neighborhood quality. And I live in a neighborhood with a whole bunch of ADUs and duplexes. And I will tell you, I live across the street from a corner store. There's a fruit stand down the road.
Mhm.
I can walk to 12 breweries from my house. It's a lovely place to live.
You said 12 breweries. Can I just like highlight how you said
I don't understand.
Oh, that's fantastic. And ditto. I mean, we're doing an ADU right now in our home, just so we can have an elderly parent come move in with us. But frankly, my husband and I want to age in place. And so when you mentioned having a caretaker move in and things like that, that's important, and that's something that folks are planning for.
Yeah.
Yeah, no, that's huge. I think the other term that I picked up, and again, folks, if you don't have a pen, I'm not sure why, but drive until you qualify. That is literally the story of my district and my county right now because folks are coming up here. We are a beautiful place to live. The 44th is amazing. No offense to the 42nd, but folks come up here most times because they've driven until they qualify for that first home, and then they stay because they love our communities, our beautiful parks, and our great schools. But Gall, I can't thank you enough. I really can't because I know the economy is top of mind for so many people, and having this time with you to talk about important issues in the economy, not just as a professor, but also as a policymaker, and of course, a candidate for the Senate. So I can't thank you enough for wanting to take on that role as well. But Dr. Representative Shewmake, thank you for your time. And folks at home, thank you for your time coming every other Tuesday this season to join us for Kitchen Conversations is just amazing. And I can't wait to see you next week in my kitchen for another great conversation. Have a great day.